Then there's 12 thoracic, 5 lumbar. The thoracic connects to the ribs. They kind of look like giraffes. The spinous process that comes down the middle, bend down in the thoracic. For the cervical, they're smaller, they kind of stick straight out. Lumbar, they stick straight out, but they're stocky, they're fat, they have a really big body. So that's how you can tell the difference between them. The parts that come out here is the transverse process, and then the spinal cord runs through, it's where this metal bar kind of runs through, is the vertebral foramen. So, questions about that? These are stacked on top of, does anyone have one that's not? Okay, well, does anyone know where the body is?
Yeah.
It's like the fat part, but if I were to stick my fingers in and pinch it, that's the body. Okay. Sacrum, coccyx, both of these are fused. Let's talk about the ribs. So the first 7 are true ribs. They connect directly to the sternum. This whole thing is the sternum. It's made of the manubrium, the body of the sternum, and the xiphoid process. The bottom 3 here are considered false ribs because they don't directly connect to the sternum, so these are false. And the bottom 2 here, which are floating ribs, are also in the false rib category, so technically there's 5 false ribs. But the bottom 2, because they don't connect, are also known as floating ribs. Questions about that? Clavicle, a lot of times they call it the collarbone. You know it as the clavicle. Scapula are these. When we talk about the parts, you have your superior angle, inferior angle, your superior border's on the top, medial border, lateral border. So if you know your sides, it makes it a little easier. The acromion process is this one here that sticks out on top. Right underneath that, you have the coracoid process. This is the glenoid cavity, and so your humerus would fit there in the glenoid cavity. This is the spine. I think that's all of them. The spine. Okay. So when we talk about the humerus, we have the head, the greater and lesser trochanter, deltoid tuberosity. Question, student? Just gonna watch, learn? Okay. Capitulum, trochlea. The trochlear notch is on the actual ulna. It makes kind of like a U. The trochlear notch is the inside, and it goes around the trochlea. Here where you have that metal part going in, where they've drilled that hole, that's the trochlear fossa. Okay, you have your ulna, the radius. The head of the radius is opposite the head of the ulna. You have a styloid process on both, so this is styloid process of the ulna, styloid process of the radius. Okay, if we talk about the 2 processes on the U, this one here is the coronoid process. The one on the other side is the olecranon process. Remember, in the middle is the notch. Any questions about that? Did I say radial tuberosity?
No.
Radial tuberosity. Most of the tuberosities are named after the bone, with the exception of your deltoid. It's the deltoid muscle. So, okay. Questions so far? I think I got all those.
So the entire, like the top of the ulna is the trochlea?
No, so the ulna has the trochlear notch, the capitulum, and the coronoid process. The trochlea is here, and then the trochlear fossa is the part, and it's what allows the elbow to bend. Metacarpal, carpal, phalange. I'm not going to make you learn the little bones, just know them as that. Okay, this whole bone is his coxal. You can see here the sacrum and the coccyx. The coxal bone is made up of the ilium, the ischium, and the pubic symphysis. So all 3 of those make up the coxal bone. You have the iliac crest, the obturator foramen, pubic symphysis. You have the acetabulum, which is where the head of the femur sits in. So the acetabulum's on the coxal bone. So here, femur, you have the head, the neck, the The greater and then lesser, sorry, greater and then lesser is over here, trochanter. Greater, lesser, over here. Make sure you, when you see the bones, figure out if it's left or right, because that'll help you figure out if it's a medial condyle or a lateral condyle. This is also medial condyle, lateral condyle. Medial, but this is malleus, and then lateral. So again, if you know left and right, it helps you determine whether it's medial or lateral. Anterior crest, it's on the front. Patella, thank you. If you look closely, these two parts that come up, that's the intercondylar eminence, the little parts that come up. Remember, condyles come out. We said tibia, fibula.